All right. Morning. My name is Porter McRoberts, and today I'm here with Verla. And 3 days ago we did a mild procedure, which is a minimally invasive lumbar decompression on Verla. And so I've asked her to explain her situation and what led her to this decision and what kind of symptoms she had prior to the procedure. Then we're going to show her MRI to show what the problem is and then how we go about fixing it. So, Verla, good morning.
Good morning.
So what were your symptoms prior to the mild? What kind of problems did you have?
Well, I had back pain, lower back pain, and it was getting very difficult to walk. The pain was going down my legs, and I would say it was close to a 10 on the scale. And I went to see a chiropractor, and he didn't seem to be able to help me. And I went to another chiropractor who in turn suggested I have the MRI. And that's when they discovered that I had a lot of stenosis and bulging of the discs. And I called and asked if, you did the mild procedure, and they said yes. So I made the appointment, and you went ahead and did the mild procedure on me 2 days ago. And the next morning, I woke up and I had no pain. I could actually stand straight and walk without any pain. And now I had the sutures taken out today, and I'm feeling great.
That's wonderful.
I feel back to normal again.
Wow. How long had you had the symptoms of the stenosis?
It started back in September.
Okay.
And I wasn't able to go up and down stairs, and as the months went by, it got worse and worse. I couldn't, really walk that well. I was stooped over a lot.
Was sitting better for you?
Sitting and laying down was fine.
Okay.
But standing for any length of time, it really, really hurt.
And walking? And
walking. It got worse, so I couldn't even, really walk that well.
Okay.
I had to hang on to things.
Okay. All right, so what was your experience with mild?
It was great. I mean, not having to, actually being there during the surgery and talking to you, and at first I was kind of apprehensive knowing that I was going into surgery without any anesthesia or anything. But once I got in there, it was quite an experience. The pain was nothing. A little pinprick, to numb the area was nothing. Especially after going through all that pain for all those months.
Yes.
So now I feel absolutely great.
And we did 2 levels?
Yes.
And how long did it take?
Well, you wheeled me in there at 2 o'clock, and there was a lot of preparation, and I was out of there by 3:30.
Yeah, that's about right. Now, I don't know the answer. How did you feel going home? What was it like walking out? Did you still have some...
Still a little stooped over because in the lower part of my back, or around my buttocks area, it was a little sore. But I attributed that mainly to the surgery.
Sure.
But from there, got in the car, and we were both hungry. We went to the Olive Garden to have dinner and came home, and I was fine.
So you went out to dinner afterwards?
We went out to dinner afterwards, so there was no problem. I could actually walk,
wow.
Which was fantastic.
Okay.
The next morning I felt a little soreness in the muscles in the upper part of my legs, but after walking around for a couple minutes it was gone.
Wow.
So I have no problem whatsoever now. I can sit, I can lay, I can walk, and I can walk straight.
That's great.
Without having to bend over.
That's wonderful. Okay. Mild is a procedure that requires taking a little bit of ligament out of the back, and I'm going to show you Verla's MRI here briefly, just to show you what stenosis looks like, so that you have an idea as to what the problem is and then what our solution is. In just a minute here. Our MRI is up, so I'm just going to turn it around here, and so you can have a look. If you can see here on the MRI, you see the white area is the cerebral spinal fluid. That's where the nerves are that go to the legs. And then you can see there's some bulges. It kind of looks like an hourglass, and the waist of the hourglass is where that stenosis is. And so you see the top one right here, if you look at it, you can see there's some nerves that are clumped. There's the spinal cord, and that looks great. But as you come down here, you notice that the nerves are clumped up. They're not straight. They look somewhat like there's less tension on them. But if you go below, they're quite a bit straight, and they're being tugged on. They're tethered, so to speak. And this area right here is where it's narrow, and then this area here is also where it's narrow. This is less so. We didn't do this level. We did these top two levels, right there and there. What's also important is, with the mild procedure, that if you look at the MRI, there's also some holes where the nerves come out on the side, and I've changed it. And those holes were mostly open for Verla, and so that wasn't the cause of her stenosis. It was really the central part right here, where you can see the disc right here, and then the ligament bulging, and we removed this black ligament right there. I really appreciate you being willing to talk about it, and I will see you back in about 2 weeks.
You don't think there's any need to go further and take any of the other?
No, I really don't. I think the whole idea is to do the minimum amount necessary. And I think probably the main problem with spine surgery is there are definitely great outcomes that occur with spine surgery, but they occur mostly when the least amount necessary is done. And so the anatomy of the spine is something that's, divine. It was divinely inspired,
Right.
and to violate it, you really have to be very careful. And so I think that's the whole point, is to do just, instead of something enormous, do the least amount that you can get away with to help.
It's fantastic. You did a fantastic
Thank
job.
you very much.
Thank you.
You're welcome.